Good afternoon and welcome to the second in our webinar series by EAS Consulting Group on the topic hemp-derived CBD. EAS is a member of the FSMA and certified group of companies and is a global leader in regulatory solutions for industries regulated by FDA. With a network of nearly 200 independent advisors and consultants, all of whom provide comprehensive consulting, training, and auditing services, EAS can ensure your proactive regulatory compliance. Our presenter for today's webinar is Dr. Omar Oyarzabal. Dr. Oyarzabal is an expert in microbiology who has assisted EAS clients as well as been an instructor in food safety, bioinformatics, biostatistics, microbial risk assessment, and management. Dr. Oyarzabal serves as a member of the National Advisory Committee for microbiological criteria for foods, is a certified HACCP auditor, a lead instructor for the International HACCP Alliance. He is also a lead instructor for preventive controls for human food, foreign supplier verification, and the Sprout Safety Alliance, as well as a Better Process Control School. He is the co-editor of two books, Microbial Food Safety, An Introduction, and DNA Methods and Food Safety, Molecular Typing of Foodborne and Waterborne Bacterial Pathogens. He also serves as the editor-in-chief of the scientific journal Microbial Risk Analysis, published by Elsevier. We'll be sending today's slides after the presentation. And if you have any questions during the webinar, you're welcome to type them into the questions box. We'll be, of course, saving all questions for the end. And with that, I will say thank you for joining us, and we'll turn the presentation over to Omar.
Thank you very much, Amy. Can you hear me well?
I can hear you great.
Great. So let's start talking about this presentation and what we have in mind for today. I would like to review a little bit quickly the Farm Bill before we go into some terms. And then after that, we are going to talk about food manufacturing, very briefly review about food manufacturing when it comes to food or dietary supplements, some specific manufacturing steps that are related to hemp manufacturing. We will talk a little bit about some specific cases coming out of the state regulations, and then we will entertain some questions. I would like to, first of all, before we start, to thank all the companies that have allowed me over the years to use some of the pictures that they have provided to me. You will see some of them today with their acknowledgement. I also want to emphasize that all the slides have a slide number in the lower right corner. So as we go through it, and if you have some particular question, you may want to keep that slide number so you can later review that when Amy sends the PDF version of this presentation. So the Farm Bill from 2018, it was really changed quite a bit of the game about how we interpret now products that are called hemp. Basically, it has a definition about hemp that is, part of the cannabis sativa plant, different components of the plant, where there is a concentration of THC, that is the 9-delta tetrahydrocannabinol, of less than 0.3% on a dry weight basis. So that really is a good definition that has been setting up how farmers now can go around and start growing these particular varieties of plants. So really the Farm Bill removed quite a bit of the restrictions coming from the US Drug and Enforcement Agency, especially for growing and cultivation of industrial hemp. So if you will, this webinar is about, how to manufacture products coming from industrial hemp growing. It define all the hemp plant, and also give the Secretary of Agriculture in each state the power, the opportunity to monitor and control growing and cultivation of hemp plants. So that's at a state level. That was done to create a little bit of a uniformity for trading purposes, okay? One thing to remember is that the Farm Bill, this 2018 Farm Bill, is not really changing too much on how FDA enforces its regulation at the federal level. So when we talk about farm and harvesting to the left, that's what the Farm Bill has been addressing, what we call the biomass that we obtain after, drying the product that was, that grew up in a farm. So we're still having questions about the manufacturing of those, the biomass, what we end up having, what are the products, where they go. That's the part that really the Farm Bill doesn't, include too much. So some terms to remember now. We have this concept of the cannabis plant being two different terms. We can use the term hemp when it's less than 0.3% for THC, and we tend to use the word marijuana in the other ones. Although remember, states are trying to move a little bit more aggressively, at least some states, to change the word marijuana into cannabis with THC content or more than 0.3 content of THC, because they want to get rid of that word marijuana that has a kind of a bad, social connotation for us. So basically, this Farm Bill created this opportunity to kind of divide the type of plants that we have, and we know that based on varieties, the ones that have less than 0.3% of THC. Cannabinoids are those compounds that we know there are a lot of them in the plant that can have some responsible effect for psychotropic, effects, like in the case of THC. There are others that, are the cannabidiols, which don't have a particular psychotropic effect. And that's the case of CBD, cannabidiol, that has become an active therapeutic compound that is considered a drug by FDA. FDA approved that drug years ago, okay? So there is a lot of work done in the drug companies trying to see where they can have use for some of these compounds coming from the plant, from the cannabis sativa plant. There are some of these drugs that has been already approved, as you can see. Some of them are not only just the purified compound extracted from a plant, but also synthetic compounds that are similar or may have a similar type of chemical composition, if you will, okay? But those are, again, drugs that have a specific approval for specific cases, okay? So, as we said, not too much has changed from the FDA position, although the definition now we have hemp versus CBD. Remember, CBD cannot really be used directly as a dietary ingredient of food because it has been considered a drug. FDA has kind of used an enforcement discretion about this because, as we will see later, states are stepping in to create some kind of, patchwork of regulations in different states. But also there are some product that has been approved as, grass approved hemp derived products. And those were approved at the end of 2018. And once it's a grass generally recognized as safe, those type of ingredients can be used in food or in dietary supplements, okay? Because the agency has already said we don't have any issue with the industry using this product as they are in those conditions. So just to mention the right side of this type of, graph that I created, that you will see it again a couple of times, just to mention that's where there are a lot of things going on still at the state levels, different type of legalization. I just put there one example of one organization that is tracking changes by state. It's a very complex one. Things are still changing a little bit, much more changes than what happened 2 or 3 years ago. But remember, we are not dealing with that part. We are dealing with the product that are hemp and could be used as ingredients. We know we have some grass compounds, and those, the use goes under the regulatory landscape that is under the FDA, the Food and Drug Administration. So they cover food, dietary supplement, cosmetics, drugs. And that's where there is an evolving market and evolving type of situation where the industry is trying to find where they can get some opportunities to create new products for the market. When it comes to those grass substances, I just want to mention quickly these notices that came out. As you can see, they are all related to the seed oil, the seed protein, because we know in the seeds we're going to have very little concentration of THC, right? So we are still having this issue of manufacturing, right? That again is the reason why we are talking a little bit today in this webinar. Manufacturing, what is manufacturing? Well, we can use a definition from the Food Safety and Modernization Act, where manufacturing and processing are kind of used as synonyms, and means to make food from one or more ingredients, synthesizing, preparing, treating, modifying. There are a lot of things that you can read in this slide: cutting, distilling, homogenization. Actually, labeling, packing could be considered that. Trimming in some cases, okay? Waxing, like in the case of waxing some fruits and vegetables, right? So that's how we have some concept about this definition. Remember that FSMA, the Food Safety Modernization Act, created a good definition of what is farm and farm activities, and then manufacturing and manufacturing activities. And those are within different regulations coming out of FSMA, right? So usually for people like me that has been in the industry for several years, we see this type of food manufacturing, right? When we visit traditional food manufacturing places. However, when we visit hemp manufacturing, we see more like what we see in dietary supplements, people that are working with dietary supplements, okay? So what we see is many of them are aligned more into dietary supplements, and therefore they have specific federal regulation to follow that are under 21 CFR 111. Some are still manufacturing food, right? Those products are sometimes not only for human, but also for animals, mainly pets. And those would be within 21 CFR Code of Federal Regulation, Part 117, okay? A different type of current good manufacturing practices. So when it comes to the steps, the steps that we are talking about are a little bit unique, okay? Because in here we start with a biomass that comes dried. Those are, parts of the plants that has been harvested, collected, and dried in a farm. And then food manufacturers or these dietary supplement manufacturers will start a process to create a finished product, okay? And there are different terms that we are using. We said that there's gonna be an extract, a crude, sometimes they call it oil. There are different intermediate steps. Sometimes people make a crude extraction and then try to purify or further refine the product that they will be using, okay? So there is quite a bit of testing related to what in the industry is called the potency. I'm not gonna be talking about that because that depends on the type of product that they're making and what they are expecting to get right out of the extractions. Not gonna go in details about the different type of extraction because there are different types, right? With solvent, different type of solvents. So at the end, they're gonna be mixing product ingredients and making either infusions, tinctures, in the case of, dietary supplement, or just making, like a brownie or a product that is an edible that would fall under the food regulatory framework. So that biomass through this farm bill has to be tested, and that's where the farm bill, gives some authority to the Secretary of State for each state to start creating these, programs that tend to kind of make more a uniform type of, testing program for the biomass that is generated, okay? So people tend to, go, and there are different states have different levels, but they have to do microbial testing. Some of the testing that we see is standard plate counts to determine general counts, bacterial count, yeast and mold. They also test for mycotoxin because the mycotoxin may be present in there, although you may have very little detectable yeast, okay? They also test for pesticide residues. They also test for heavy metals. Mainly it's gonna be arsenic, lead. Those are the main, heavy products that are being tested. And the reason is because, these plants tend to accumulate that. So arsenic, lead, and mercury are gonna be some of those products that are gonna be tested. Also depends on the soil where those plants are being, grown, okay? Of course, they have to determine the cannabinoid concentration, remember, has to be less than 0.3% of THC. And they tend to also dry the plants, create a dry product. So the moisture content is an important one, right? So that biomass will go into a facility where they're going to do extractions, and those extractions in different ways are going to end up being part of a finished product. So what I see is a lot of changes in the microbial law just because of that particular type of process, where you have a large mass of dry vegetables that go through a series of extractions with, different type of solvents because you're looking for a specific product. And then eventually, those are the products that will be, mixed with ingredients to create a finished product, okay? So when it comes to manufacturing, like any type of food manufacturing, and even in the case of dietary supplements, when we work with companies, we always try to make sure that they understand that there is a careful choice of word that they need to use. for instance, the product that are already in seeds, that they are under the generally recognized as safe, the grass status, as we just saw, they can be sold and they can be added as ingredients. There are some already been used quite a bit. There is no limitation with that, no major issues. When it comes to hemp, some people tend to use hemp to infuse edibles, and they start using the word infusion or infuse. And that's where I always ask them, are you really talking about an infusion? What are you talking about? Let's define that. Because an infusion in some cases may bring the opportunity for Clostridium botulinum to, actually multiply, and as soon as they start multiplying, they're going to be producing toxins, and we know these are really strong neurotoxins. That is a major food hazard that we want to control. Okay, so this is where I am mentioning, just remember, you have to be careful about the choice of words. In some of these cases, when people are trying to create complex foods, I always remind them that they need to have somebody to review their formulation, their manufacturing steps, to make sure they don't create a product that may give, Clostridium botulinum an opportunity to multiply and generate toxins. So I use infusion because I am originally from Argentina, and you can see on the left side, you have what we call the mate, that is a gourd with a little straw, and we just drink an infusion. That's an infusion. I also like teas that are on the right. It's a black tea that is an infusion. Those are safe, but there are some that can be a little bit more complex, okay? And that's where we use the traditional type of, processing condition that we have used for the formulation of food and dietary supplement for many, many decades, where we try to evaluate for water activity, different temperatures that the product goes through, the pH of the finished product, combination of pH, temperature, water activity. So these are evaluation that we don't have like a template that we can give people and say, run with this and it's going to be fine. In many of these cases, it becomes a case-by-case type of, evaluation. All right. So remember, this is something that is still evolving, and we are trying to, provide a little bit more of the support to the industry to make sure that they generate products that are safe. I mentioned the states because the states are still playing an important role in here on how they are going into setting up different manufacturing, regulations, if you will, within the state. So they realized that the 2018 Farm Bill gave them a lot of opportunities for this farm to grow. So we have, for a couple of years, a lot of farms making product, but we don't have a lot of, clear regulation on how to manufacture that biomass. So really the answer in here, it depends on the importance for each state. I just providing there one example of the amount of money that can bring from the state. That take it with a big grain of salt, because there are here, estimation that include not only cannabis, not only hemp, but also cannabis with higher concentration of THC, what used to be called marijuana. So which is a different area, right? It's regulating different ways, but again, states are allowing them to be sold within the state. So just understand that it's not easy to get real good number of the impact when it comes to only food or dietary supplements. Most probably the major impact is going toward the calculation of that money that comes as revenue in most states from the sales of cannabis with higher concentration of THC. It also depends on how much of an industrial hemp program has been organized, of course, the resources within the state, and how much they are being paying attention and helping manufacturers. I hear some states that have some financial incentive more than others. Like here where I am in the state of Vermont, there is a specific taxing system, okay? One thing to remember is when you look for states, again, don't go into the marijuana part if you're doing things. We are not talking about that. Like in the state of Colorado, there's a different website that is for hemp in food. And that's where we are having more and more, the states having better, I would say, better definition. I don't know if they are that clear, but better definitions about how to go around with the manufacturing steps. So let's just use a little bit the state of Colorado as an example. The Department of Public Health and Environment is the one that oversees part of the manufacturing, packaging, and the dietary supplements of this product. They ask for manufacturers to be in compliance with the state laws and licenses. So they're going to have to get product that were, coming from farm that in a way are licensed by the Colorado Department of Agriculture. So again, this is an example in which the Department of Agriculture in the state that have been driving the farm bill, have been creating the opportunity for biomass. Now the Department of Health in different states take care of that. In few states, all of that may be under the same umbrella, under the same state agency. In many states, they are divided, okay? They are adding a statement like that, a statement that you read towards the end. The product, it has been not tested by FDA for efficacy and safety. They're putting some labels, like warning labels. They are really being proactive in telling people, watch out with the claims that you're trying to make, because that can get some people in trouble, okay? Another example that I would like to mention quickly towards the end is what's going on with the Department of State of California. They have a Department of Cannabis Control, where if you go, it has a lot of interesting, information. There is a rulemaking. The governor in California recently signed a new bill to, start officializing, if you will, a little bit more of the sales of this hemp product. And that's the AB 45. And I would like to review a little bit like part of this bill. In this case, also the manufacturers of food or dietary supplements that want to use hemp are going to have to, register with the state. Also demonstrate that the plants come from a state or a country that has established and approved industrial hemp program. Okay, so they are, all of them are kind of tidying that up to, the fact that they want to make sure that the product has been already tested through what are, the conditions that were established by the 2018 Farm Bill. They have to have a specific testing that they are following the same one, less than 0.3% of THC. They are asking for laboratories to have an independent type of testing. In some cases, we see quite a bit of laboratories popping up a little bit to provide some service at the state level. Those laboratories will have to go through a series of, accreditation in order to be accepted. That all varies. Sometimes the industry, especially those manufacturers that are using this product for dietary supplements, they are already having quite a bit of testing in place in-house, okay? They also talk about this, you know, a statement that they want to have on the labels. The FDA has not evaluated this product for safety or efficacy. There are some concerns and some issues about keeping this product away from the reach of children. One interesting thing is that in this regulation, the state regulation, they're talking about the California Department of Health kind of reserves the right to probably impose maximum serving sizes later. So I think they are going slowly to it and making sure that, you know, there is no abuse on how, you know, manufacturers are going to be selling or how, you know, the consumer are going to be using this type of product. Some they clearly say that for them, industrial hemp product doesn't include what is already called as generally recognized as safe, because they are already being kind of approved by FDA for use as an ingredient. We already mentioned that. They also kind of use towards the end of the slide, you can see some interesting definition about manufacturing. They are saying that the manufacturing for them don't include what is grading, trimming, curing, drying, harvesting, because that is kind of already hijacked or taken care of by the people in farms that are really, you know, growing the plant and doing all that part at the very beginning. So for them, that's a little bit of an exemption. It shouldn't be considered manufacturing activities per se. So where is the industry is going? Well, we wish we could know the future, right? Nobody knows, but again, dietary supplements products are coming more and more. They have the opportunity to do a structure function claim that can give them an advantage. Just adding an ingredient to a food and you cannot have any claim is not really very enticing, I think, for the food industry, okay? There is a lot of testing for potency. There is quite a bit of variation in methodology. Probably you've seen that from the previous webinar last week, where that was mentioned a little bit, and the importance of testing. Remember also, pharmaceuticals that are creating drugs are very much involved in this, and I'm putting a lot of money. So once some of these products are being approved as drugs, it's kind of hard to go and try to prove that now they can be an ingredient in food. Actually, that's something that cannot be done according to the Food, Drug, and Cosmetic Act. So we already have very solid, you know, federal regulation prohibiting that, right? So you cannot add a drug into a food or a dietary supplement. So let me summarize a little bit this presentation. As we said, hemp products can be used as food ingredients in food and beverages, dietary supplements. There's going to be more and more use also in cosmetic products, as beauty and personal care products. Those specifications that they are being created at the different states when it comes to that biomass that is collected at the farm, they are coming out of that farm bill, and those specifications are kind of guiding already what manufacturers are requesting, because manufacturers, you know, are gonna be the customers of these farmers. So in a way, those farms, those products are what, you know, are the suppliers for them. We see quite a bit of testing. I don't know what is gonna last for a long time. It seems that we are doing a tremendous amount of testing with heavy metals and you know, pesticide residue that I don't think make too much sense in the way we grow those plants in here. At least not to do it just in a blank slate for all the states. So there may be changes that we will probably go through once we feel more comfortable that we have the data collected to make some of those decisions. So when it comes to the manufacturing side, that's where we have the regulation, all of them really within the Food and Drug Administration. And the regulations are clear in the fact that the idea is to prevent adulteration and misbranding of product, right? There are more and more states coming out with their regulation, even smaller ones. The question is, what other products from the plants will be used as ingredients in dietary supplements and food? That's a very good question. And that's where I think there is a little bit of this race between dietary supplement companies and food companies versus those that are in the pharmaceuticals looking for drugs. And we know which one has more money. And it's going to be an interesting race to see what are the products that are, you know, kind of extracted and purified from that plant. Remember, we talked about more than 100 products that are part of that plant, some of them with similar structure. So we are still on a case-by-case basis when it comes to evaluation of food product. Remember, for those that are interested in manufacturing, the creativity ends up when you are having some issues with safety. So make sure that any kind of complex food that you want to create is evaluated for safety. I want to mention a little bit about this website that is a little bit older. FDA is very active in recruiting information. And I think this is going to be what in the near future is going to be driving again, where we see more products to come. So with that, I would like to open up a little bit to some questions that there may be.
All right, great. Thank you. Can you hear me?
Yes.
Perfect. Okay. Before we get started with questions, one thing I forgot to mention, just a reminder, next week's webinar, instead of being Wednesday, is on Thursday. So after the conclusion of this webinar, I'm going to update the Zoom information, which will send you a new email. The link is the same. It's just instead of Wednesday next week, we're going to meet on Thursday. Our speaker for that one will be Dr. Tara Couch, who is our Senior Director for Dietary Supplements and Tobacco Services. So we have one question so far, and that it does not mention which slide, but the question is, which mycotoxins are of concern?
In general, the mycotoxins that are evaluated are the vast majority are going to be coming as aflatoxins. There are very few others that we know of. Aflatoxin is the main one. There are already a lot of tests, rapid test kits for detection of aflatoxin or other mycotoxin, because remember, this is an area that has been explored for many, many years for grains. You know, remember, we sell corn and soy and even peanuts. They all have to be tested for residues of mycotoxins. So we have quite a bit of science and a lot of relatively inexpensive systems like lateral flows that can tell you the amount that you may have.
All right, thank you. Our next question is, can you elaborate on what a GRAS compound is?
A GRAS, yeah. So a GRAS is what is called generally recognized as safe. So back, I may not have the right year, but back in the 1950s, early 60s, I think it was in the 1950s, the agency, the Food and Drug Administration, kind of starting to group products that were under their supervision, especially some you know, additives and ingredients. They starting to create more information about the knowledge that they have through that. And there was a term that was created then that is generally recognized as safe, which means that a product that has historically been used under certain conditions that has been proved to be safe. So that's the reason why a GRAS status allows for that ingredient to be used in many different formulations, because we know that as long as you use it for those particular, usage that you want to intend to have in the product, they're going to be safe. So that's the GRAS status. The agency uses historical data to do that, and they receive a lot of requests sometimes from some products to go into that GRAS status, but sometimes they deny those because they don't have enough information to make that conclusion.
Okay, thank you. Any other questions? Here we are. Are there currently any hemp products that are GRAS?
That are GRAS? Can you repeat this?
Are there currently any hemp products that are GRAS?
So the ones that are already coming out of the seed are considered GRAS, and they are usually excluded for what is called the industrial hemp programs that the states have been setting up. So we don't have others products that are hemp derived that are GRAS coming from the industrial, hemp production. We don't.
We have another question that is an opinion question, and that is, if and when FDA does pass regulation for hemp CBD, do you think it will be allowed in food and supplements, considering there's already a CBD drug?
It's a very hard one. It's no, the tendency and the history tells us that once a product is within a category, within drug, it's not going to be allowed to be as a food or a dietary supplement. Again, I mentioned the Food, Drug, and Cosmetic Act that prohibits that. Can we have similar type of product that are not called CBD that may be accepted as safe as an ingredient? Maybe, but CBD as it is already a drug.
All right, thank you. And just waiting to see if there's any other questions to come in. Okay, I don't see any. So Dr. Oyarzabal, thank you so much for your time today and this great presentation. Thank you everyone out there for joining us. We always appreciate your interest in EAS and our webinar and training programs. So our next one is next week on Thursday. You'll be receiving a new email with that updated date. And the reason for that is just because I could not set up a series without all of the webinars being on the same date. So thank you again. We'll see you next Wednesday and have a great week.
Thank you, Amy.